All right, welcome back and thank you for keeping it TV47. This is Body Garage, where on this episode we are focusing on chronic kidney disease, and taking me through it is Dr. Hussein Bagha. Daktari, before the break you had gone through the stages. By the time someone now gets to stage 5, does it mean now they have complete kidney failure?
So stage 5 is classified as end-stage kidney disease, or in layman's terms it is kidney failure. And that is a point at which now we start talking to patients about now the therapies that are now available, which is either dialysis or a kidney transplant. Yeah.
For this stage in particular, the kidney functions are completely null.
So by the time you're reaching end-stage kidney disease or stage 5 kidney disease, it would mean that your GFR, or the percentage at which your kidney is functioning in layman's terms, is less than 15. So it means that a lot of the functions of the kidneys are not being performed. So like your regulation of your fluid status in the body, removal of excess water, removal of the toxins, regulation of your electrolytes, regulation of your acid base in the body, your blood levels, all of that is now being hampered. So all these functions are not being performed by the kidney. In some patients, when they reach this stage, depending on other factors, we do start them on dialysis. In some patients, we do have some time where we can talk to them about getting a preemptive kidney transplant, meaning that you don't go undergo dialysis but go straight for a kidney transplant. Or we wait until the percentage of the kidney falls to less than 10. In some patients, we do have the leeway of waiting for that before we start the dialysis.
For the end stage, it's until the percentage of the kidney function is less than 15 or 10 for others.
15,
What
yeah.
is the normal first for someone with healthy kidneys, and then also take us through for the different stages from 1 to 4?
So what happens is, if stage 1 is anything more than 90, and then stage 2 is anything between 60 to 89, the percentage, and then so it goes on like this depending on your glomerular filtration rate. So these numbers that we are talking about are basically your glomerular filtration rate. But remember, now we've also included another component, as I mentioned earlier, about the proteins in the urine. So apart from just the stage, whether it's stage 1, 2, 3, 4, 5, or we also have to include now the proteins in the urine, because if your proteins in the urine are high, it does signify that you are at a risk of developing end-stage kidney disease faster. Yes.
Okay.
So we have to take all of that into account. And of course, if it's less than 15, your GFR, that's stage 5, and then 15 to 29 is stage 4, then 30 to 59 is stage 3, and then 60 to 89 is stage 2, and anything more than 90 is considered to be stage 1.
Okay.
So that's in a nutshell, looking at the figures and everything. But of course, it's a bit more complex than just looking at one value.
Yes.
Yeah. It has to be taken into account, the entire picture.
Okay. And what does the diagnosis now look like? What are some of the tests that are carried out?
So as I mentioned earlier on, the two most common tests that we do is, one is your urine test, which is very easy to do because it tells us whether you have any proteins in the urine, whether you have any blood in the urine. Then the other one is a blood test, where we look at a chemical called creatinine, which will then help us to know or calculate your estimated glomerular filtration rate. Yeah.
Let's get to the treatment bit of it. Now, options that are available through the different stages. Let's begin with stage 1. What are the treatment options?
So we don't look at the stages apart from the fact that when you reach stage 5 or end stage, of course, now you have to undergo renal replacement therapy. But as long as you have been diagnosed to have chronic kidney disease, then there are the baseline treatments or strategies that we use, which include, of course, developing a healthy lifestyle, so eating healthy, exercising regularly, avoiding the over-the-counter medications, which I'm going to re-emphasize so many times, so please don't get bored, avoiding herbal medicines. So this cuts across the stages. Okay. Then you have to look at what the cause of the chronic kidney disease is. Is it diabetes? Is it high blood pressure? You have to control your blood pressures, you have to control your blood sugars. That is of utmost importance. So you also have to look at what the cause of the kidney disease was. Like as we had mentioned earlier, that the most common cause is diabetes and high blood pressure. And you have to control your blood pressures, you have to control your blood sugars, because that was what caused the chronic kidney disease. And if your blood sugars are not going to be controlled well, or if your blood pressures are not going to be controlled well, then it is going to cause more damage to the kidney and cause faster progression to end-stage kidney disease. Then as a disease progresses, as the stages worsen, you start getting the complications. Like we mentioned, you start getting anemia, which is whereby your blood levels are low, your potassium levels start going up, your phosphate levels start going up, your acid levels in the blood start going up. So all of that have to be treated as it happens. And this is why follow-up becomes very important with your nephrologist. Then there are some medications that now have come into the market, which basically have been shown to slow down the progression of chronic kidney disease to end stage. But of course that is to be given at the advice of your kidney specialist. Now, if by any unfortunate means you do reach end stage kidney disease, or it's first diagnosed at the level of end stage kidney disease, then the treatment options are much more limited, because now you have to start talking about renal replacement therapy, which is either dialysis or a kidney transplant.
Or a kidney transplant. Okay, let's focus on dialysis. What is it and how does it work? So
dialysis is whereby a machine takes over the functioning of a kidney. We call it a surrogate kidney. I think we have a machine behind us, and this is what a dialysis machine basically looks like. You have a catheter which is inserted into one of the blood vessels in the body, and through which the blood comes out of the body and goes through the machine, where it is cleaned, the excess water is removed, the electrolytes are balanced out, the excess acid is also removed from the body, and then it is returned back to the body. So once when you start dialysis, normally for patients who have got end-stage kidney disease, they are on dialysis either twice a week or thrice a week. Yeah.
And how long does a dialysis session take?
So normally a dialysis session lasts for 4 hours. Yeah.
There are two types of dialysis. What could you mention them in depth?
So the one that we do commonly in Kenya is called hemodialysis, whereby we have this machine. Hemo stands for blood, so the blood comes out of the body and it runs through the machine, where it is cleaned and then returned back to the body. The other one is called peritoneal dialysis. In peritoneal dialysis, a catheter is put inside the abdomen and some fluid is put inside the abdomen through that catheter, stays for a few hours, and then it's removed. So that fluid helps with the exchange of the electrolytes and removing the excess water by sucking the water out, and then it's subsequently removed. But commonly in Kenya, we do mainly hemodialysis.
Hemodialysis. And at what point, Daktari, do you decide that now, dialysis is not working? Perhaps you could get to, a renal kidney transplant.
So it's not that the dialysis is not working. Dialysis is supposed to be a stopgap measure. So every patient should be offered a kidney transplant. Of course, there are criteria to determine who is transplantable and who is not transplantable. Of course, if you have certain conditions that may preclude you from a transplant, but ideally all patients should be offered a kidney transplant. So once when a patient reaches end-stage kidney disease, the nephrologist or the kidney specialist should start talking to the patient about the different types of renal replacement therapy. The kidney transplant is preferred over dialysis because it makes the patient return back to as normal a life as somebody who has not had kidney disease. They live much longer than somebody who is on dialysis. The complication rates on dialysis are there. They tend to get infections and a lot of other problems which are mitigated once when somebody gets a kidney transplant.
And so for the one that would opt for a kidney transplant, how then selecting the donor, how do they do it? How do you advise for them?
So here in Kenya, we only do the living kidney donation, and we opt for the donor to be a relative, for obvious reasons, because we still don't have the regulations in place to protect the donors. There can be a lot of exploitation And so that's why the centers, and MP Shah Hospital is one of the centers that does regular kidney transplants. Actually, we just done one today morning. We do prefer that it's supposed to be a relative, and the person who is becoming the potential donor undergoes rigorous tests to make sure that they will not get any kidney disease later on. So that it's not that we are removing the kidney from one person, making the other person healthy, and then later on this person who is donated develops end-stage kidney disease. So they have to undergo rigorous tests to make sure that they will be fit to be kidney donors, and the risk is minimum for them to develop any kidney disease later on in life. Yeah.
Are there any complications as a result of a kidney transplant?
For the donor or the recipient?
For both the donor and the recipient.
So of course, I mean, it is a surgery. So there are the surgical complications that can happen, but this is why we do this a very thorough workup for both the recipient and the donor. The recipient undergoes a full cardiac evaluation or evaluation for the heart to make sure that they are safe during the procedure, anyone after the procedure as well. Even for the donor as well, we make sure that everything is going to be safe for them during the surgery and even after the surgery as well. Generally, worldwide, the complication rates for the donor are very few. Of course, it has to be done by an expert in an expert hospital, in a transplant center. So that's one of the things that we always have to keep in mind.
So someone can comfortably live on one kidney?
Somebody can comfortably live with one kidney for the rest of their life. The risk of developing kidney failure after donating is very, very low. So it is safe. But of course, safe to the extent that we do a thorough workup for the donor to make sure that they don't get kidney failure later on.
For someone now living after the kidney transplant, are there medications that they're supposed to be on? How is the follow-up care for such a person?
So for the recipient, they need to be on medications to make sure that their body does not reject the kidney.
Okay.
So they have to be on what is called the anti-rejection medications. And these medications they have to be on these medications for life. That's very, very important. And it's important to counsel the patients as well that it's not that it's the end of this thing once when they undergo a successful kidney transplant, then everything stops. No. So medications have to continue for life. They have to be on very regular follow-up with their kidney specialist to make sure that everything is going on well. They have to do regular tests as well. Initially, in the first 1 year, it is more frequent. Then as the years go on, it becomes less and less frequent, and in the third year, once every 3 months. Of course, depending on what caused the kidney failure, if it was diabetes, high blood pressure, you have to control your blood sugars, you have to control your blood pressures, you have to make sure that you avoid the over-the-counter medications again, no herbal medicines, eat healthy, exercise regularly. So all of that still has to be enforced.
Okay, Dr. we are up for a second commercial break. When we will be back, we'll discuss so much more. Is this chronic kidney disease preventable? Do not go too far. Keep it TV 47.